Hey, so I wanted to tell you about one of my favorite conditions to treat as a pediatrician because I kind of look like a rock star when I can fix it. And this is called radial head subluxation or nursemaid's elbow. So let's talk about what it is and why we love it as medical providers, because we get to actually fix something and the kid feels better immediately. It's so cool in most cases. So radial head subluxation is something that can happen in children, especially under the age of about 4 or 5, because of the fact that infants' bones and joints are their joints are free floating. So the bones have to actually grow together to create those nice joints. So I always think about younger babies under the age of 4, that their joints are kind of free floating and there's ligaments and tendons holding everything together in a bunch of black space in the center. So you go to kind of grab a kid because they're going to fall, or you swing them by the arm, and what happens is the radius bone, which is right here, there's a ligament that wraps around the head of that bone, and it pulls a certain way and it pulls that ligament over the head of the bone. So it's not a true dislocation, but it's a dislocation of the ligament. And it can be a simple mechanism. It can be a simple fall. It can be a pulling mechanism. And they pull against you in the grocery cart and they're going to fall, and you grab their arm and you can feel a little bit of a pop, and then they just won't move it. And they just stand just like this. Sometimes they'll tell you that their wrist hurts, but they just won't move their elbow. So the sooner we get to this, the quicker we can fix it. So here's how we know it's a radial head subluxation or nursemaids. Because of the mechanism, first of all, there's usually not a lot of swelling. We kind of examine all the way around, make sure we don't see anything else that is wrong. We go by history, age of the kid, how they're acting, and then we can actually put this back in place in clinic, which is really cool. So we do a mechanism where we actually can put this back in place, which is super cool. So what I do is I put the baby in the mom's lap, or the older toddler in the mom or dad's lap, and they're facing outward. And I tell the parent everything I'm going to do beforehand, because they're going to scream like bloody murder. So I want to make sure I explain everything, what I'm going to do, how it's going to work. So what you do is you actually take the arm and you pull it out, and then you push it up and you push down on it. So you start like this, flip it up, push it up, and push down on it. You have to do it kind of in a swooping mechanism. When you do that, what will happen is that ligament will slip back over the head of the radius. The kid's pain is almost instantly gone within about a few minutes. I usually leave the room for a few minutes because they're just kind of mad that I'm in there and they've been in pain for a little bit. So I give them time and I tell the parent, give them a minute and see if they'll use it. And I used to love this in urgent care because I'd walk back in a few minutes and the kid's running and playing and using their arm, and the parent's like, "You're amazing." And we don't get to hear that very often in pediatrics. So it's super fun and cool. This is common. It happens a lot, sadly. The sooner we get to it, the better. So if this happens, make sure you get care sooner rather than later, because the longer it stays swollen, the harder it is to get put back in place. We're not going to hurt them by trying to put it back in place. Every once in a while, there's also a subtle fracture too. It still doesn't hurt them. It's better to do that. So it's a common thing. Ways that you can prevent it: don't swing your kid by the arm. Do your best not to grab them by the arm if you can help it. And then just reach out to us if you think this has happened to your child, because again, the sooner we get to fix it, the better. Take care.